Hey everybody, I'm here with Jude and Grant at Outcomes. Guys, how are you guys doing?
Fantastic.
Awesome.
Awesome show?
Yeah, great show so far.
Yeah, that's excellent. So tell us a little bit about how you got together here and everything.
Sure. I mean, we known each other for a few years working together. Our company we started with was Transaction Data Systems. We focused on pharmacy management services and software, and we worked with Brent's team and his company on bringing clinical services over. And recently we came together. And Brent, what about get a little background on your business?
Yeah, so I came from Cardinal Health, where we acquired multiple companies and built an internal business inside of Cardinal called Outcomes, which was really focused on how do we drive more clinical work into these pharmacies. How can we help pharmacies generate more revenue opportunities beyond the script? And partnering with TDS, which is one of the leading pharmacy management systems, we just found we had similar missions, similar visions on how we were trying to really help the pharmacies thrive.
So terrific. And so what new innovations then are you really bringing to the pharmacy here today?
Well, a couple things. First off, when you look at their constituents, they have the patients coming in, the ability to connect the patients directly with pharmacies, key. But we also work directly with payers to bring services and dollars down through the pharmacy to the patient, so actually create new revenue streams and opportunities as a pharmacist becomes more clinical focused versus just doing dispensing of drugs. How do they go do vaccines? How do they go take on clinical services? We also work with pharma, bring in adherence programs through our technology. So our objective is really to find ways to pay the pharmacies and chains more money than they actually pay us, and generate new revenue streams for them.
Okay, so what common needs and challenges are really our customers encountering today in pharmacies in relation to this?
I would say, where we're really focused is in three areas inside the pharmacy. One, like Jude mentioned, patient engagement.
Yeah.
How do we help those pharmacies digitally connect to their patients? How can we put the patient more in control of their pharmacy experience? That's one. The second is operational efficiency. How can we help the pharmacy free up more time for the pharmacist to do work beyond just filling the script? So how can we help them with virtual verification, load balancing, and then finally, how can we drive more clinical opportunities into that pharmacy? So once we've helped the pharmacy free up the pharmacist and pharm tech's time, how can we fill that time with more meaningful clinical work that they're going to get reimbursed both from payers as well as pharma manufacturers?
So it really is doing a great job in increasing efficiency and streamlining the pharmacy operation.
We're trying really hard to create solutions in that area as well. We feel like we're one of the largest, if not the largest, double-sided network. So we're a cloud-based solution where payers and manufacturers are putting millions of opportunities into this platform. We're finding the right pharmacy to deliver that work to that patient on behalf of that payer. So it's one of those cyclical things, or like a flywheel, where the more work we put in from payers and pharma, the more work the pharmacies do, the more time the pharmacies spend in our solution, the more work gets done. So it's a double-sided network flywheel effect.
Yeah, we're really lucky where we have about 49,000 retail pharmacy stores in our network and over 80 million lives. So that size and scale.
That is impressive.
To bring that across in a digital platform, as we unify the platforms to have the first fully digital enabled technology that you can do, connection with patient, connection with pharma, connection with provider, payer, everything.
Right. And so, on the retail side of it, the patient has really experienced an increased level of service of the whole 9 yards, which adds to patient retention to that pharmacy. It increases the value to that patient, and so everything is elevated. Is that right?
Yeah, like with for some of our solutions, we'll provide like a mobile app. We'll do texting. We're doing bidirectional two-way texting. So the patient will get like a refill reminder. They can say, hey, I want to pick it up at this other store versus the store I traditionally do. They can do mobile pay. They can, some pharmacies go to the express lane to just pick up their bag because they've handled a lot of it themselves beforehand.
Yeah.
So we're trying to make the pharmacy experience as digitally friendly as, tracking your Domino's pizza to your house.
That's fantastic. And what what other means can you help the retailer here, the pharmacy retailer, in terms of what you do to move the entire program forward? I mean, is there anything else you want to add to that?
I would say, one of the things that we're really excited about is launching some medical billing solutions for clinical services. So, as that pharmacist is filling out that work and in our system doing traditional payer business, there's also an opportunity for them to document and get reimbursed through medical billing means for some of the work that they're doing. We're doing some interesting things around scheduling, digitally texting folks. We're working really hard to integrate our IVR and our digital platform, so it's all one platform. So as someone's calling in, if there is a little bit of a wait, we can look into the pharmacy management system and see, hey, this person's due a flu vaccine, or we can prompt them right away, hey, would you like to be texted, so you can schedule a time to come in for a point of care testing. So we're trying to integrate all these ways to communicate with the patient to really free up the pharmacist's time.
Yeah, it's fantastic, really. I mean, it's great news. And so that's basically, that's all I've got for you right now. Do you guys want to add anything to it? Or?
No, really appreciate the time.
Yeah, thanks for swinging by and seeing us. We're really excited about where we're going. More to come.
I mean, honestly, 80 million, you mentioned that number.
Yep.
It's a huge number. And so what you're doing is just really fantastic. I think in terms of healthcare, streamlining everything this increases efficiency, lowers costs for the patient, increases revenue for the pharmacy.
That's exactly right. You got it.
It's a
Those
win-win.
are the big three. Yep.
Those are the big three.
Yep.
And this is also applicable to a major chain as well as a small pharmacy.
That's right.
Everything across the board.
You got it.
Guys, thank you so much.
Awesome. Thanks, Chris. Yep. Thanks for your time.
Thank you.
Thank you.
You got it. Thank you.